This is a case of 39-year-old male who has deformity since birth, and he has presented to us with recent onset difficulty in breathing and pain in the deformity. Patient is nil neurological, and patient is asking that, doctor, if I go for the surgery, is this surgery safe? So what is the safety in the surgery? What determines the safety? Is it guarantee of excellent outcome? Is it assurance that no neurological deterioration will happen? Not really. The safety in the spine surgery means to get the best possible outcome with minimal collateral damage using best technology in the hand. And the upcoming technology is use of ultrasonic bone scalpel in deformity surgery. Various companies has this device. Technology is more or less same. So the generator of the device, it produces electrical impulses which through resonator causes deformation of piezo ceramic rings, which in turn converts electrical impulses into the ultrasonic impulses, and through concentrator, it helps to move the insertion tip to and fro, which helps in cutting of the bone. Advantages being the minimal impact on bone and soft tissue, reduced risk of damage to dura, nerves, and vessels, maximal surgical precision, minimal bone loss, and blood-free surgical site. Various papers are showing advantages of using ultrasonic bone scalpel, which shows reduction in the blood loss, reduction in the surgical time, and reduction in the dural injury. However, there are only few papers in the spinal deformity. So the aims and objective is to determine the safety and efficacy of ultrasonic bone scalpel in the spinal deformity surgery. This is a retrospective analysis of the patient who was treated between 2010 and 2021 and who was treated for index spinal deformity correction surgery using pedicle screw construct. Rest all patients are excluded from this study. We have 63 patients who we have divided into 3 groups: AIS and congenital scoliosis, neglected adult scoliosis, and degenerative scoliosis. In group 1, there is statistically significant reduction in surgical time in ultrasonic with the use of ultrasonic bone scalpel group. In group 2, there is appreciable reduction in the surgical time and blood loss. However, that was not statistically significant. And in group 3, there was statistical significance reduction in surgical time and blood loss. We have encountered some of the complications such as dural injuries and neurological deterioration. However, they were not statistically significant. Being a retrospective study, less number of cases are the limitations of this study. And we have to take in the account that many other tools along with ultrasonic bone scalpel is used during surgery. These are the few case examples, and this is the video demonstration of use of ultrasonic bone scalpel during deformity correction surgery. To summarize, ultrasonic bone scalpel is effective device in performing deformity correction surgery. Both blood loss and reduction in operative time is appreciable in all 3 groups. So to conclude, ultrasound bone scalpel is indispensable tool in armamentarium of today's spine surgeon who are performing deformity correction surgery. Thank you very much for your patient hearing.